Good afternoon and welcome to our daily media briefing. Excuse me. As we wrap up with our final media briefing for the week, I wanted to give a heads up about next week's schedule. Next week we'll have what we expect to be a fairly lengthy board meeting on Tuesday as we discuss different proposals to work with the state on an accelerated reopening plan. Because of that lengthy meeting, we will not have a media briefing on Tuesday afternoon, and we won't have one on Thursday afternoon. We'll move to a Monday, Wednesday, Friday briefing schedule starting this next week. However, on the days we're not having briefings, our media office will continue to send out updates with the latest case numbers, and they will continue to handle inquiries. Also, we will be flexible and hold briefings if there are significant new developments or important news that we need to get out. And as always, you can check with our coronavirus website at coronavirus-sd.com for updates. I want to emphasize that although you see myself, Supervisor Fletcher, and our doctors up here every day, there is a lot of work that is going on behind the scenes. Our fellow supervisors, our county employees, our county leadership team are all working very hard and are fully engaged in responding to this crisis and are putting in some pretty long days. We know that you're with us and we appreciate all the support. We appreciate all the work you are doing to practice social distancing, wearing facial coverings, and avoiding large gatherings. And we certainly appreciate all the individuals and organizations throughout the region who have stepped up to help their fellow San Diegans. So let's keep up the great work. With that, I'll call up Supervisor Fletcher to go over the numbers.
Thank you. Good afternoon. Every day for a while now, we've talked about the importance of testing, tracing, and treatment as a cornerstone and foundation for how we come out of this in a responsible way, recognizing coronavirus will be with us and will be a threat for the foreseeable future. But if we have that system in place to be able to rapidly test, trace, and treat on an ongoing basis, and if we all will adhere to the basic principles of physical distancing, face covering, hygiene, and temperature screenings, then we believe that it is possible to reopen our economy in large part and get things moving again without seeing a massive spike in cases and an overwhelming of our healthcare system. But of course, a foundational part of that is our ability to continue to see progress towards our goal. We've outlined an initial goal of 5,200 tests per day that we would like to see in our region. Yesterday, we had our single highest day of testing throughout the duration of the coronavirus pandemic with 3,998 tests. Today, we have surpassed that goal and are above 4,000 tests for the first time with 4,055. We will have days that are up and days that are down, but again, our trajectory is in the right direction, and we are doing well as a region in tackling this very difficult challenge of testing. But it's not enough to just have a number of tests. We are following the protocols and prioritization that's been outlined by Dr. Wooten in her guidance in terms of testing, but we also have to ensure access. We have to ensure equity. We have to make sure that communities that may not have the same historical access to health care have access to testing in a meaningful and sustained way. We've talked a lot about what we're doing in the south part of our county surrounding testing. You heard about a lot of that yesterday. And I want to spend just a moment talking about what we're doing in southeast San Diego. Tomorrow, the county's Live Well on Wheels mobile office will be making its third consecutive Saturday appearance at the Euclid Health Clinic on Euclid Avenue in southeast San Diego. But starting tomorrow and moving forward every Saturday, we plan to have this same testing opportunity available every Saturday for the foreseeable future in southeast San Diego at the Euclid Health Clinic. There are approximately 70 tests available on these Saturdays from 9 a.m. to 3 p.m., and they are free, but appointments must be made in advance by calling 211. So if you live in southeast San Diego and you would like to schedule an appointment for one of our Saturday drive-up testing, you can call 211 and make an appointment to get tested there. But that Saturday testing is not enough alone to meet the need of the community. And so I'm pleased to share with you that with the support of the state of California, we are putting a state walk-in testing in southeast San Diego starting Tuesday, May 19th. This is similar to the testing we've been doing at 3 locations throughout the county via the state, and so we will be moving a lane of this, a resource of this, to the Tubman Chavez Center at 415 Euclid Avenue starting on Tuesday, May 19th. This will offer approximately 132 appointments a day from 7 a.m. to 7 p.m. And you sign up for these via the same link and 800 number that we have shared with you in the past, and we can put out again. But this is a new opportunity for ongoing and sustained testing in Southeast San Diego. I also want to announce last month Governor Newsom announced a disaster relief fund for our state's immigrant population. These are folks who work. Many of them are essential workers. They contribute to our economy. They pay taxes, and they work in our vital core sectors of many of our essential businesses. And so I'm excited to share with you now that the San Diego Disaster Relief Assistance for Immigrant Programs is going to launch on Monday, May 18th. Jewish Family Services, which is a tremendous asset to our community, and an organization that time and again has stepped up to provide critical roles and fill a great need. Jewish Family Services will operate the State of California Disaster Relief Assistance for Immigrant Project for San Diego and Imperial counties. This project is a one-time state-funded disaster relief for undocumented adult immigrants impacted by COVID-19. Any individual who qualifies can receive $500 in direct assistance with a maximum of $1,000 in assistance per household. Again, this will be beginning Monday, May 18th. Applicants who are eligible can seek assistance through the phone hotline for San Diego County. That number is 858-206-8281. And again, that will start on Monday. And our thanks and appreciations go to Jewish Family Services for once again stepping up to provide a great role. Let's jump into our slides here, our T3 testing, tracing, and treatment. Very happy to bring this slide up today. We are over 4,000 tests being done. We want to continue to see this step up progress. And again, just to highlight that there's a lot of challenges associated with this, whether it be personnel, supply chain issues, the variety of supplies that need to go into collecting the sample and transporting the sample, processing the sample, along with issues of scheduling and the logistics of individuals signing up. We are daily working through and breaking through all of those challenges and want to continue to see forward progress on our testing numbers. We're now over 96,000 total tests reported. Slight tick up in contact tracers, 175. This continues to increase. We think next week we'll continue to see more advancement as individuals that we've brought on board are trained and equipped and ready to deploy. 191 individuals in our public health motel rooms, 686 total to date. Next slide, you'll see today we're reporting 132 positive test results. Again, that's out of 4,055, our single highest day of testing ever for a 3% daily average. We've now brought our rolling 14-day average down to 4.4%. As we expand testing, we expect this number to continue to trend downward as we are testing a much wider sample and variety of folks. On our daily hospital census, slight uptick in ICU beds, overall hospitalizations for COVID about where they were a week ago, so relatively flat, but certainly something to keep an eye on moving forward. But when you take the COVID hospitalizations on the next chart at 399 and put them relative to non-COVID, you see we still have a healthy gap of bed system capacity available to us in our region, and that is encouraging, and we appreciate our hospital partners for their continued help. Last one is just our cumulative totals. You see 5,523, estimated recoveries over 3,500, cumulative hospitalizations, a doubling rate of every 29 days, ICUs, a doubling rate of every 37 days, and then 8 additional deaths, and our thoughts go out to each of those families. With that, I will turn it over to Dr. Wilma Wooten for her Public Health Officer's report.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and thank you for joining us for today's briefing. As usual, the global, national, and state statistics today are based on data from the Johns Hopkins dashboard. Obtained at about noon today, the information is as follows. Globally, there are over 4.5 million positive cases, including almost 305,000 deaths. Nationwide, the United States is reporting over 1.4 million positive cases, or 32% of the global number, and includes over 86,000 deaths. Statewide, California is reporting over 75,000 positive cases, including 3,054 deaths. And today, the County of San Diego is reporting 5,523 cases, which is 132 more cases than was reported yesterday. And this includes 208 deaths, which includes 8 new deaths reported since yesterday. Of the 5,523 cases, 60% of these are Hispanic or Latino, 25% are white, and 4% are Black or African American, 8% are Asian, and 1% is of multiple races. Also, for Pacific Islanders, they also make up, or this group makes up about 1% of the total number. And 0.2% of the total number of cases are American Indian. The age range still has not changed since last Friday, now from 3 months of age to 101 years of age. 52%, up by 1% from yesterday, of all of the cases are between the ages of 20 and 49 years of age. 49% are female, 51% are male, and 19% or 1,070 of cases have been hospitalized, and this also remains constant. Of the total number of individuals hospitalized, 325 or 6% have been admitted to the ICU, and this is 6% of the overall total. The 325 also is 30% of those hospitalized. The 208 deaths represent approximately 4% of the total number of cases. Of the additional 8 deaths being reported today, the age range is from 65 to 94 years of age, and all had underlying medical conditions. And of all of the 208 deaths, 44% are female, 56% are male. And regarding race and ethnicity of all deaths, we have data for 91%, or 189 of the 208 total number. The numbers have not, for race and ethnicity, the breakdown has not significantly changed. We have 45% whites, 43% Hispanic or Latinos, 8% Asian, and 2% African American, and just slightly over 1% are Pacific Islanders. And for both American Indian and multiple races, there is 1 death each, and this represents 0.5%. My sincerest sympathies go out to the families and friends of the 8 additional cases that we reported that have died from COVID-19. As a reminder, all of the demographic information that I've shared with you and more is found on our county's website. That is also found at the bottom of most slides and in front of the sign before me. Regarding reported outbreaks in congregate and community settings, to date, there have been a cumulative total of 69 confirmed active outbreaks. Of these active outbreaks, 46 are in congregate facilities, with a total number of congregate cases at 1,269 cases, which includes 97 deaths. There is also a report of 23 active outbreaks in community setting locations, with 1 new outbreak since yesterday, which includes 275 cases and 5 deaths. Now, we are officially today 1 week into stage 2 of the governor's resiliency roadmap. And I'd like to thank everyone for adhering to the governor's executive order, including our health officer, local health officer order. Going forward, There are 4 strategies that I commented on yesterday, and I want to reemphasize them again today. There are 4 strategies that will ensure that we are successful at reopening. These include maintaining good hygiene and sanitation, social distancing, facial coverings, and screening. Now, these strategies are proven and beneficial. Knowing them, however, and doing them are 2 different things. So the culture of adherence is very important in ensuring that these strategies are successful. As work sites began to screen individuals, including temperature checks, symptom checks, and a history of exposure to someone with COVID-19, as people return to work, identifying individuals with symptoms will prompt our T3 strategy, again, which is testing, tracing, and treatment, which includes isolation. Lastly, the fact that the number of COVID-19 deaths is not higher is a testament to the power of the community and demonstrates all the positivity that can come when we work together. As the metrics continue to trend in the right direction, as Supervisor Fletcher has shared with you already, the county must be vigilant in monitoring these data to identify any rebound or trending in the wrong direction as businesses and work sites reopen. As life slowly starts to move forward with a new normal, I commend everyone's efforts and strongly encourage each of you to keep up the great work that you've done so far. These precautions will help us get back to the things we need and enjoy while taking on this still unpreventable virus. So now please welcome back to the podium, Supervisor and Chairman Greg Cott.
We'll go right to the questions, and again, please identify yourself with your name and your outlet if you're not identified by such in the introduction.
Matt Hoffman with KPBS. What's your question, please?
Hi, in talking to restaurants, it's my understanding that the Great Plates Deliver program kicks off tomorrow. Do you know how many seniors have signed up for in our county and what expectations you all have for the program? I know you said it's like intended for seniors who can't get meals anywhere else.
Okay, Supervisor Fletcher is going to respond.
Yeah, thanks, Matt. We just launched that program, so we're not sure since we announced it yesterday to today how many have signed up, but we can track it down and try and get it to you.
Gotcha. And I know that some eateries, I mean, obviously, if it's just starting this weekend, they only have like 1 or 2 people signed up. Do you expect that to increase over time? Like, do you think that there's a need for this program still?
Well, I would think the numbers would increase from the first day after we announce it, so probably the second and third day until we get to capacity. In terms of the need of the program, we outlined yesterday the initial duration of it. I do believe there is a need for seniors who don't qualify for existing nutritional programs who need help. So I do believe there is a need. We're going to maximize that program to the extent possible by funding and what we have to try and provide as much help as we can to as many people as possible. So we think it's a really good program. It not only serves a need for seniors who are not covered by other programs, but it also helps out our restaurants. And so the ability to go out and engage some local restaurants, get them back preparing food, preparing meals, and get them delivered, we think is a good thing. So, and we'll keep you posted on the progress of how it advances.
Cool, thank you. And can you confirm, is it starting tomorrow, like Saturday? Is that the first deliveries going out?
I'll have to check for sure. I know we opened it
Okay.
up for
No
signups, but we can pull all that and get back to you.
All right, thank you.
Yep.
Just as a follow-up to Matt's question, we have confirmed that we've had over 1,300 calls, and they're being screened right now for eligibility. Let's go to the next question.
John Carroll with KPBS. Please state your question.
Hi, Supervisor Cox. In regard to the letter that you and Mayor Faulconer sent, I don't know, I can't remember if it was earlier this week or late last week, asking for more local control and therefore for the ability to get the county opened up faster. What about, what will you do if the governor refuses that request, if he disagrees with what you want to do? Will you go ahead and advocate for certain businesses to go ahead and open up anyway, or what will you do exactly if he refuses you?
Well, I'll just speak for myself. We're certainly going to abide by what our public health officer feels is comfortable as far as reopening. As far as the governor, he's got standards that he's got set up. We're going to be presenting or be hearing a presentation for an aggressive reopening plan, which may move some activities that were in stage 3 over to stage 2. That would be a request to the governor, that the governor would have the opportunity to review and hopefully, given the track record we have here in San Diego County, I know he's called us out several times in a positive sense for the work that we're doing. So I would hope we'd be able to demonstrate to the governor that in San Diego County, we have very good public health officers and other doctors that are working on this issue. And if they think that we're in a position to open in a more aggressive manner, that he would take that into consideration. But ultimately, the governor is going to set the when. What we've been working on is the how. We want to make sure that all of our businesses are ready to reopen when they get that green light.
Thank you very much.
Okay, next question. Okay, we're going to go directly now to the texted questions.
Yes, and this first one is from Mike McKinnon with KUSI News. Will the county allow other businesses to reopen ahead of schedule if they implement strict safety protocols like the casinos did?
Okay, Dr. Wooten's going to respond.
The short answer to that question is no.
Thank you, Dr. Wooten.
Okay, let's go to the next question.
And this is from Kogo News. Some sailors tested positive again on the Theodore Roosevelt. Is it possible they have gotten COVID again?
Okay, I believe Dr. Wooten's going to respond.
I think that's a question that's best suited for the Navy. We don't know the details of that, of what's going on, so that investigation really we are not involved in. So I'm sorry, I can't answer that. Thank you.
Dr. Wooten.
This next question deals with testing, and so we're going to ask Nick Mascione, our Director of the Health and Human Services Agency, to respond.
Yes, this question is from Will Huntsberry of Voice of San Diego. The state has opened 3 testing sites in the county. How many tests per day can those facilities do?
We can handle 132 appointments per lane. These are walk-ups, and they run from 7 a.m. to 7 p.m. We have 2 lanes in Escondido. We have 2 lanes in Chula Vista. We're expanding 1 lane from the Grossmont to El Cajon at the assessor's office, and the other lane, as Supervisor Fletcher mentioned, will be going to our Chubman Chavez Center starting next week.
Thank you.
This next question deals with some border-related issues, and Dr. Wooten's going to respond.
This question is from Alexandra Meeks with CNN. It's actually 2 questions. The county has mentioned an increasing number of dual citizens are crossing the border to seek COVID-19 treatments at Scripps and Sharp hospitals in Chula Vista. Approximately how many of these cases has the county recorded?
So the number of cases, we don't have that specific information, and it probably would be best to call the hospitals that are in South Bay to ask that question. As has been stated on several occasions, the coalition that has been convened by the City of San Diego that involves over almost 20 different organizations. There are data sets that are being monitored in terms of transports, crossings, as well as the hospitalization at the southern South Bay hospitals. but it is very difficult to ferret out of those hospitalizations how many are due to individuals that are coming from Mexico.
And the follow-up question is, Scripps Hospital has asked for health screenings going both directions on the border. What is San Diego County Health Department's stance on this? Would requiring health screenings at both sides of the border be helpful for San Diego hospitals?
So as you heard in my comments, screening is very important, and we certainly would be in support of screening on both sides, but those are decisions that would have to be made by the federal governments of both countries. So we would support any efforts of those nature, but again, those decisions would not reside with the County of San Diego.
Thank you, Dr. Wood.
Well, that completes our questions for today. Again, we hope everybody has a very enjoyable weekend. We'll be back here on Monday at 2:30, and again next week we will be planning on having these briefings only on Monday, Wednesday, and Friday. So again, we hope you have a very nice, enjoyable weekend. It's going to be a beautiful weather, and we would encourage you still to stay in place, maintain space, and cover your face. Thank you. See you next week.